you want it to go. Some things happen, but some things we can prevent. Hello, everyone. Thank you for coming on to my live about the secrets to control labor pain without an epidural. My name is T. Hello, everyone. Thank you for coming on to my live about the secrets to control labor pain without an epidural. My name is Tiara. I'm the quick birth coach, and I am giving you secrets today. I'm so glad y'all came onto the live and joined me. We're just going to get right into it. I'm a no fluff type of woman. We're just going to get right into it, right into the secrets. All right. Why should you care about this webinar? Well, you should care about this webinar because these secrets should be widely known. When you are in labor and you resist and you tense up with your contractions, it results in a longer labor. They normally will have to induce you. That induction leads to an epidural because with the induction, you have these painful, irregular contractions, causes you to want to reduce the pain by getting the epidural. You get the epidural, which results in they lessen your contractions, so it results in you having the longer labor. The longer labor, you're exhausted. It causes you to sometimes go and to have a C-section and just get it over with. So if you can endure this pain, you can speed up your labor process and you can have a better experience. All right, so we're going to do a quick exercise right now. So grab an ice cube, grab a bag of peas, and come back. I'm gonna give you 30 seconds to go grab that. Come back. I got mine. If you're new here, thank you for coming on. Consider subscribing, like the video so other mamas can get it, and fathers too, so that they can tell their pregnant wives or pregnant girlfriends to come on or give them tips. Thank y'all for joining. Thank y'all for joining. Grab an ice cube. Come on, let's go. All right, if y'all got an ice cube, type a 1 in the chat. Type a 1 in the chat if you got your ice cube or your bag of peas. All right, I have mine. So what we're going to do right now is we're going to take the ice cube and we are going to first just put it on your wrist. If you have a bag of peas, just hold it with 2 hands. We're just going to put it on our wrist. Ready? Go. For 10 seconds. All right. Y'all feel it, right? Now, some of you may have already put the ice cube down, but it just shows a little bit of anxiousness. So the next thing that we are going to do is we're going to train our mind to better endure pain, better endure uncomfortable situations. So we're going to take the ice cube next and we're going to just hold it in our hand. If you have a bag of peas, take the bag of peas and hold it with 2 hands. And we're going to breathe while we're holding it. Take a deep breath and breathe while you're holding the ice cube. We're going to do that for 45 seconds. Let me set my timer. Ready, go. Take some deep breaths. I know it's cold, but you're training your brain. You're doing these mental activities to train your brain to endure uncomfortable situations. Keep it in your hand. Don't drop it. Just breathe. And time. Y'all did a good job. How was that? All you're doing is training your brain. You can do little tactics like these to train your brain to endure labor pain, to get used to the uncomfortability of labor pain. So what will we go over today? So we're going to go over the least, from the least to the greatest of secret. I'm going to tell you about my experience and who I am. And I'm going to show you the best kept secret of all, but you have to stay to the end to get the best kept secret of all. So in a birth, we do not want to plan to have an unmedicated birth, but ultimately have to have to get an epidural or get a C-section, right? We want to keep the birth plans that we have, and we want to execute our birth to the best of our abilities. But we have to learn certain things before we go into birth so that we can be prepared for it, right? We don't want to feel like you're not a mother. What I mean by this is a lot of women, when they feel like they have a C-section, they feel like they didn't birth their baby out, and that makes them not a mother. Well, I want to tell you that you're still a mother. You still are worthy. You still had a human. Don't feel like you're less than because you didn't go the route that you wanted to go. Some things happen, but some things we can prevent. So that's why we're on this live right now, so that we can learn certain things, so that we can go into labor more confident, to feel more accomplished once we have our baby. Now, if you stay tuned to the end, we're going to show you different results where you can reduce these things that you do not want, but you got to stay to the end. So my ideal prospect is a mother of any race, any ethnic background, who wants to learn and be taught and be coachable. So a first-time mom, she had a previous labor, birth after a C-section, mom with previous children, non-high risk, medicated birth. You want a natural birth, you want a home birth. You need to learn these tactics. So stay to the end. I'm going to give you these secrets. A little bit about myself. I was terrified when I had my firstborn. And the reason I was terrified is because I kept hearing over and over that a first-time mom, you're going to have a 20+ hour labor. That's like the minimum. And I was like, to be in labor, hurting for 20 hours, not me. So after that, I just prayed. I'm a big faith woman. So I just prayed and I asked the Lord to give me guidance on how I can go about this labor and not be scared, and to have a shorter labor and control my labor pains in my labor, right? After that, I was grateful because my cousin-in-law, he actually brought me some scientific trials that he discovered on this method to have an easier labor. I'm going to get to that at the end, but you got to stay to the end. So I did those methods. I implemented those. Along with that, I had a doula myself. Firstborn, I had a doula. And my secondborn, I lived out the country in New Cairo, Egypt, and I had a doula over there. I had a home birth. It was a great experience over there, but I was also terrified because of the new environment. The things that I learned from our doulas and the inspirations they have given me and the empowerment they have given me inspired me to be a doula myself. So I went ahead and I went to a doula training from Donda International, which is a real-renowned doula and training company. I did free long-distance birth coaching. Some of the things that I have seen in this space while doing some birth work behind the scenes is that the pain regimens is normally the same. Get on your birthing ball, double hip squeeze, deep breaths, figure eights on the birthing ball. A lot of that is the same. And I wanted to create this live so that I can get some new information out there, some things that I've learned. One of the things that I have learned through failing is that one of my clients, the pain management methods that we were doing, which I learned, it worked, but it wasn't as effective because it led her to get an epidural. She could not tolerate the pain, and she did great. She did a wonderful, but ultimately it gets like that sometimes. So I wanted to figure out how can I better help my patients during a labor process. Through research, I ultimately found like a method that I was using when I was an athletic training student. I graduated from Eastern Illinois University with my degree in kinesiology. But before I graduated, I was an athletic training student for the women's and men's tennis team, the women's basketball team, and the men's football team, right? And we had to use a certain device. And I discovered that this device also translated to labor. So Stay tuned. You're going to know which device I'm talking about and what secrets that you can use that I know from my experience. I want to let you know that I commend you. So everyone, right now, just drop some flowers in the chat for yourself. Drop a bouquet of flowers in the chat for the next mother that you see in the chat. Because I commend you, because giving birth is hard. We push out a human that we have cultivated and incubated for 10 months, right? So every kind of birth, you should feel amazed and you should feel accomplished, whether it is a natural birth, a epidural, if you had to get a C-section, emergency C-section, if you had health problems and complications. We could have died from giving birth. Like literally, our body is hijacked. Our hormones are hijacked. So I just want to say, you are a blessing. You are a blessing for pushing your children into this world. You still a mother if you had a C-section. Like a lot of things that our body had to go through and recover from. The postpartum happens all the way up into a year after you have your child. Your body is still trying to recover. So I commend you. I give you your flowers right now. Going through this, I hope that you will feel empowered. I hope that you will feel more confident as we are approaching your due dates. Live may not be for scheduled C-section moms or high-risk moms, because normally you have a C-section and you go in at a certain date so that you probably won't endure labor pain as much. You may feel some little cramping, but for gestational diabetes, you can book my coaching with me. You just have to book a call. What we're going to go over today, the first secret that we're going to go over today is earlobe acupuncture. All right. Then we're going to go over a birthing cone. Next is a TENS machine. Now this is the one I used on my athletes when I was an athletic training student. Okay. And the fourth secret is instant pain relief from cryo vibration. I know y'all like, what is cryo vibration? But I will tell you, just stay tuned until the end and you will know, because at the end, I will give you the biggest labor hack for an easier labor altogether. All right, that's the bonus. So you got to stay to the end for the bonus. We got to start at pain, right? Where's the pain coming from when I have a contraction? Well, pain is coming from your nerves sending signals back to your brain that it's a threat. Now, obviously, that our baby coming out is not a threat, but it's sending signals back to the brain. Studies have shown that we can trigger those same nerves to decrease that pain. And that's what we're going to talk about today. You can actually decrease your labor pain. I know people are like, oh, it's going to be pain. Well, first, let's stop calling it pain. Let's call it pressure, right? It's just pressure. Think about it as pressure, labor pressure. We can do things to trigger the nerves to decrease labor pressure. Now we got to talk about acupuncture. Acupuncture stimulates the body to heal itself, right? So we're going to talk about the gate control theory and explains how acupuncture actually works. So this technique activates the parasympathetic nervous system to slow down the brain waves to secrete the relaxation hormones. While you're in labor, if you're feeling stressed, anxious, worried, you can do this technique and it can put things in a slower, more calmer, manageable state for you so that you can start to do the other pain relief activities that I'm going to show you in a bit. So, but we're going to practice this actually. I need you all to drop an ear emoji in the chat if you are ready. Okay? Drop one in the chat because we're going to practice this real quick. Now, you can do it if you have a headache, if you have sinus problems, if you just need some relief, if you have a wandering mind, if you have a busy mind, you can still do this technique, okay? So what we're going to do is we're going to take our earlobes and stretch it out. Stretch it out. And then when we stretch it out, we're going to pull down. Now, you're going to hold this for 45 seconds. Now, I don't know about you, but I immediately feel relief in my, I feel my ears being unplugged. I feel like I can breathe in my brain. I feel like my sinuses are draining. What about you? What this is supposed to do is reset your brain. I just feel so relaxed. It's like a reset. What about y'all? Drop an ear emoji in the chat if that worked for you. Like it worked for me. It worked for me. Drop an ear emoji in the chat. All right, the next secret. The next secret is an acupuncture for a cone. So this will stimulate the endorphins to help you cope with stress and pain. So we're going to do a demonstration. This is activating non-painful nerves to block the pain signals. So we're going to apply this cone. Just get a simple cone and apply it around the geolong pressure points, which is where the palm meets your fingers, right? Along here. And we're just going to squeeze. That's it. So when you do this, while you are in labor, you are activating gate pain theory. So your body cannot focus on multiple pain at a time. So these non-painful trigger points, pressure points, will block out the pain for the painful pressure points. Does that make sense? If that makes sense, drop a hand emoji in the chat if this method makes sense. So when you are in labor, you're going to focus on this, squeezing this, right? You're going to squeeze it, and it's going to block out the pain. Drop a hand emoji in the chat if this method makes sense. We're going to move on to the next one. So this next method is called the TENS machine. It is the transcutaneous electrical nerve stimulator. So what this does is it sends out tiny electrical impulses to your back. The patches of your back is going to go over the nerve pathways on your back. You're not going to put it on your stomach. You're going to put it on the nerve pathways on your back. So 2 is going to go under your bra line, under your bra strap. And the other 2 is going to go by the dimples of your back. We're going to see a demonstration. You cannot put this in water. Do not put this in water. You are not going to get in the shower with this. You're not going to get into a birthing pool or anything like that. So I use these on my athletes to reduce their pain and to help them recover quicker from injury when I was an athletic training student. Remember, I told you that I was an athletic training student for the women's basketball team, the men's and women's tennis team, and the men's football team. So when they have injuries or they was recovering from an injury, we put this on, we sit them on it for about 30 minutes or so, or maybe less. And it helps them recover quicker. So when you are in labor, this TENS machine is great for blocking out the pain and tricking your brain. So this TENS machine is great for tricking your brain and blocking out the pain and helping you last longer. Mothers have said that with this TENS machine, they pulsated as they're having a contraction, and the contractions significantly reduce, and they are able to manage and progress along with labor. This is how you put the patches. You put 2 under the bra line and then 2 at the dimples of your back, and it is along the pathways of your nerves, sending signals to the brain. Please do not put this on your stomach. Put this on your back. You cannot put it in water. The next secret is probably my favorite, and this is cryo vibration. Now, you're probably like, what the heck is cryo vibration? Well, it is cold meeting vibration, and it reduces pain almost immediately, almost on contact, right? You have to actually go to the VibraCold website and get this. I'm going to soon have an affiliate link for this, but you can go to the VibraCold website and get this. And I recommend getting the Flex, because the Flex, you can put this on your back, and it is an elastic band that you can put on your back. It just allows for pain relief on contact. The person who came up with this idea was Amy Baxter. She's a researcher and she's a physician. She did 45 million trials. She originally developed this device called Buzzy. It was for needling procedures to decrease pain with children. And her coworker at the time asked her if he can use this device, this cold plus vibration device, so he can avoid taking opioids, if he can have it doing a knee replacement surgery. By him experimenting with this cold plus vibration, he was able to have a full knee replacement surgery drug-free. Like, it's amazing. So what she discovered is that motion is the most effective in shutting down the gate on sharp pain. The right frequency of vibration triggers the nerves so that decreases pain. The cold triggers the brain to decrease pain everywhere else. So this cryo vibration decreases pain significantly, almost on contact. You can buy this on Amazon. You can use it while you're in labor. When you have your contractions, you can put it on your back. You can put it on your side, and the vibration plus the cold will help soothe the pain for you. Now, obviously, the patch is not big enough to go across your whole back. But if you have an ice pack that big or a cold pack that big that can put around your whole back, you can use this vibration. You may be cooking with some gas. So I highly recommend you going to get this Buzzy if you can, or getting the VibraCold and having that vibration plus that cold, put it on your back, put it on your sides, and it will significantly reduce. Now, I'm not saying that the pain is going to go away completely. The pressure is going to go away completely. No, the pressure is still going to be there. But this will significantly reduce the pressure that you are feeling when it comes to your contractions. This will help you go feel less stressed and less tense as you're going into your the higher stages of labor, going 10 centimeters, right? This will help you get there more comfortable, right? You may still have your long labor. However, if you're going to have to endure it with less pressure. Okay? Type a B emoji in the chat if you're going to do cryo vibration when it comes to your labor and delivery. Type a B emoji in the chat. If I would have known about this when I had my labor, this would have been a game changer. I didn't do this one, but this is a game changer. The research that has came out about cryo vibration. Type a B emoji in the chat. And like and share the video. Like and share this video and subscribe. That will help someone see this. Another mother may see this and get this information. So like the video, share, subscribe. Thank you all for being here. Thank you all for tuning in with me today. So when you do these tricks to help significantly reduce your labor pain, you can sleep during contract. Like, you need to rest. If you are exhausted by the end of your labor, you're not gonna have enough uh to push through, and you may just feel like you can't do it and opt into a C-section. This is going to reduce your need for a C-section and reduce your need for an epidural, right? This is very important. You can labor more at home. You need to get your rest in between your contractions. You need to labor at home, because if you do not labor at home, when you get to the hospital, you cannot eat. They do not want you to eat because you may have to get surgery, which is a C-section. So labor at home, get a nice meal in because you need energy. Labor equals work, right? The definition of labor is work. So you need to have your energy so that you can be able to endure this long work. And the belief in yourself increases, your empowerment increases. You will not need an epidural with this because you will feel confident. Okay, I can endure this. And then when you look up, they check your cervix. Oh, you're 7 centimeters. Yeah, it's been some hours, but you were able to laugh. You were able to eat. You were able to sleep. You were able to rejuvenate. And then boom, okay, it's labor time now. These tricks are very important. This live is very important. Like I said, share to a mother, share, like this video, and share and subscribe, and send to a mother who maybe recently had a baby. She may want another one, or she may be pregnant right now, or a father who's caring and loving, and he want to help his wife the next time around. So share this video, like this video, so the algorithm can put it out there. Okay, so like I said, you really need these skills because the Pitocin inductions make the C-section rate go up, right? So we need to be able to endure labor without trying to opt into a C-section, or, give you more empowerment so you won't feel like you have to opt into an epidural, right? So the C-section rate is just way too high in hospitals today, right? So the target C-section rate is supposed to be 23. It's supposed to be 23%. They're all the way up to 78%, right? It's between 40 and 78. Some hospitals are lower or in between, but people are opting into C-sections who do not even need a C-section, right? So the hospitals, they are encouraging it because they make more money off of you having surgery versus you having a normal vaginal delivery, right? In a normal vaginal delivery, you only stay in there probably 24 hours. You're in and out. But it takes a little bit more work because they have to have on-call staff for 24 hours, and they get paid less by your insurance, $14,000 for you having a vaginal birth. Versus if you was to have a cesarean, they get paid $26,000, and it only take about 40 minutes, and you stay in the hospital for 96 hours. So they are getting money on you from your insurance, and they are milking it any way they can to get you to stay in the hospital, to get you to have surgery so that they can get more money, right? So it's imperative that you get the knowledge that you need to feel empowered so that you won't have to opt into having a C-section or a cesarean because you feel like that you don't want to go through that, you don't want to go through that pain. And some people, hey, you have a low pain tolerance, that's fine. If you opt into a C-section, that's fine. But the people who are opting into it and they are not high risk, meaning they don't really need a C-section, but they opted into it anyway, use these tactics, use these tricks so that you can be able to feel empowered to go into your birth and feel like you don't have to, that you can do it, because you can do it. Your body is made to do it. So use these tactics and these tricks and these tips to help you do it and help you do it more comfortably. So we all have somebody around us that has had children before, but that doesn't necessarily mean you are an expert at birth. You just had children and you have your experiences with your birth and your children. A birth coach is knowledgeable about birth, knowledgeable about the hospitals, knowledgeable about the ins and outs, the ticks and tricks, the things about your health, the things that you need to do in regards to leading up to your birth, the things you need to do surrounding it, the foods you need to take, the positions you need to be in to turn your baby. Like birth coaches help you in a broader spectrum with that support than you just listening to someone who have a child, who had a child before, right? So a lot of the times you don't know what you don't know. And the person who has given you that advice in their next birthing experience, they should also get a doula to help them, because they don't know what you don't know. And some people, hey, you don't need a birth coach because you have a ton of support and you feel like you know all there is to know, and that's great for you. But for the people who don't, you don't know what you don't know. So it is imperative that you actually get help from the person or from people who you know who actually are birth workers. So the bonus is here. This is the time you have been waiting for. And thank you for watching to the end. I really support you tuning in to this live and to the launch of my business and to the launch of Birth Champion Incorporated. This bonus is the secrets that I have given you, the value that I have given you today about having significantly less pain in your labor process. I invite you to schedule a call with me. I am the Quick Birth Coach. I have a birth coaching program to help you have a quicker and easier labor and delivery with less fear and anxiety around birth. As a birth coach, I support you and your partner. Donda International Workshop is the leading organization for doula training and certification. And I got my training through Donna in 2018. And I have been on and off birth coaching during that time, right? So I invite you to schedule a call with me to see about my birth coaching services to give you support during and after your childbirth to make you feel empowered. When I had my doula, my first doula, her name is Mia, she empowered me so that I can be able to, if I didn't like that nurse and I feel like she was rude, I can say, no, I don't want you. I need another nurse, no, I don't want this shot with my child. I don't want that vaccine. I don't want, my child to do this. I don't want my child to go there. I didn't know that I had that power. And with that education and that love and support from her, I was able to go into the hospital with my birthing plan, and my husband, he knew my birthing plan, and I was able to advocate for myself and stand up for myself, or have my husband stand up for us, because we already had a plan going into my birth that everyone was supposed to abide by. And then if they did not abide by that, they were looking at me with more respect, because I knew what I wanted. My husband knew what we wanted. And I would advocate for myself. They didn't just do anything or say anything, but I got that empowerment from my doula. So I am extending the same courtesy and offer to you to join my birth coaching. Now, I was listening to a woman who I was talking to. Her name was Connie, and she was talking about how she had a 52-hour labor, and if she would have had these methods sooner, then it would have saved her some agony. So my birth coaching program, it entails live coaching calls once per week with other members for support, questions, and answers. Me implementing the secrets on how to significantly reduce labor pain, assessing your pregnancy stage and your birth plan so that we can see where you are now and where you want to go based on your ideas, and I can give you some of my advice as well. And then we are incorporating my cheat code method for a quicker and easier birth. Now, it's a lot of stuff that you can do out there, but the problem with that is you only get one shot. And at that one shot, you're doing multiple things while you're in your pregnancy. You don't know what worked and what didn't work because you only got one shot. I have my experience And I have scientific trials to back up my method. So book a call with me and we can see if we are a good fit to work together with my cheat code method. We're going to go through breathing techniques to help you increase blood flow to your uterus. It's going to be a great program. You have access to me for your support. I'll give you advice. We can work through whatever situation you're going through, and we can work through that together. And we have a community group for paid members only. So you're going to book a call with me. This program it's not for everyone, right? It's not guaranteed that we're going to work together. So I'm selective about who's in my program because I need people who are willing to be vulnerable, willing to be taught. I don't need people who, if you think that you got it all figured out and you know everything, that's fine. And then, I'm just not a good fit for you. However, I need people who are willing to apply my techniques and to actually listen to instruction and to give me feedback so that I can grow and I can get better and I can tweak some things so that I can see how I can better help you and I can better help others by the feedback that you give me. So right now is the part where I'm dropping the link in the chat right now so that you can book a call with me. Book a call with me. See if we are a good fit to work together, right? So I'm dropping it in the chat. All right. Thank you all for your participation today. Like I said, like and share this live to a mama who needs it, right? To a mama who had a birth already. She may have some other births in the future. She's pregnant right now. A mother who's terrified, a mother who's a teen mom, and she's pregnant, a first-time mom. Share this video, like this video. Thank you all for participating with me. My name is Tiara. I'm your quick birth coach, and bear good fruit. See y'all next time.